Hi guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm explaining hearing aid best practices. Hearing aids continue to be the best treatment option for over 90% of individuals with hearing loss. However, just because hearing aids may be your best option, it does not mean that they are guaranteed to work well for you. In fact, many people experience little to no benefit using hearing aids, even if they are using some of the best hearing aids in the world. Now you're probably wondering, how is it possible to spend upwards of thousands of dollars on hearing treatment and not receive any benefit? Well, the biggest reason for this is that best practices were not followed when selecting, fitting, and programming those hearing aids. Unfortunately, experts estimate that only 10 to 30% of hearing care professionals actually follow comprehensive best practices in their clinics. And finding one of these clinics is like finding a needle in a haystack. This is why understanding what best practices are is so important. So what exactly are hearing aid best practices? Basically, they are a long list of procedures that must be completed by a hearing care professional to ensure that you receive the maximum amount of benefit from hearing aid treatment. There are several published best practice guidelines from the American Academy of Audiology and the American Speech Language Hearing Association. Let's talk about some of the best practices included in these guidelines, starting with speech and noise testing. Chances are, if you have hearing loss, you have difficulty hearing and background noise. Speech and noise testing allows your hearing care professional to measure your ability to separate speech from background noise. If you score well on this test, then you know that properly fit and programmed hearing aids will be enough to overcome a noisy environment. However, if you perform poorly on this test, your provider will know to discuss additional assistive listening devices that can help you in noise even more than just using hearing aids alone. Real ear measurement is another commonly known best practice procedure. Real ear measurement allows your hearing care professional to measure the amount of amplification you are receiving from your hearing aids and verify that you are meeting your hearing loss prescription. If you are not meeting your prescription, they will be able to adjust your hearing aid programming to match your prescriptive targets. If real ear measurement is not performed, then there is no guarantee that you will receive maximum benefit from your hearing aids. The use of diagnostic test box measures is another best practice procedure that is extremely rare to find inside of a hearing aid clinic. Test box measures allow your hearing care professional to identify if your hearing aids are meeting manufacturer specifications. This is kind of like when you take your car to an auto mechanic and they hook up your car to a computer to diagnose where the problem is. Oftentimes, if you're having unexplained difficulties with your hearing aids, it's that your devices are having a mechanical malfunction that cannot be identified unless test box measures are used. Best practices also require that we measure how much subjective benefit you are receiving from your hearing aids. And no, asking you how does that sound is not what I mean. Hearing care professionals measure subjective benefit using validated outcome questionnaires like the COSI, IOIHA, and AFAB, among others. These questionnaires will indicate if you're perceiving significant benefit from your hearing aids and what areas of your treatment still need improvement. Now keep in mind, these are only 4 of many hearing aid best practices that must be completed by your hearing care professional if you want to receive the full amount of benefit from your hearing aids. If you would like to learn more about hearing aid best practices, make sure that you like and subscribe to the HearingLoss.com YouTube channel to catch more of our informational videos.